Many patients come to me with a foot drop, a condition where they struggle to lift their foot while walking. It's not just about the discomfort, it's about how it affects their confidence, independence, and everyday life. But the good news is, there is a solution. Hi, I'm Dr. Pramod, and today I'll help you understand what foot drop is, why it happens, and how we can treat it effectively. What is foot drop? First, let's understand what is foot drop. Foot drop is not a disease, it's a condition, a symptom. It means that the muscles responsible for lifting the front part of your foot are weak or it is paralyzed. So instead of stepping forward smoothly, your toes might drag on the ground, making walking difficult. It can affect one or both the feet, and it can happen suddenly or gradually. What causes a foot drop? Now, why does this happen? Mainly, there are three reasons or three culprits. Number one, the main cause of foot drop is nerve damage. We call it as a neurological cause, which can occur due to conditions like nerve injuries, diabetes, stroke, herniated discs, or neurological disorders. Just like an electric wire that has been cut, if the peroneal nerve, which controls the foot movement, is damaged, signals can't reach the muscles. The second one is muscle disorders. Certain conditions like muscular dystrophy weaken the muscle over the time and making the movement harder. And the last one is brain and spinal cord issues. Strokes, multiple sclerosis, or spinal cord injuries can disrupt the communication between the brain and the foot muscles. Think it like a miscommunication between your brain and the foot. The foot wants to move, but the signals aren't getting through properly. Our goal is to correct these causes and help the patients regain the normal movement. Symptoms of foot drop. How do you know if you have a foot drop? Here are some common signs you need to observe. Difficulty in lifting the front part of your foot, dragging your toes while walking, compensating with a high stepping gait, numbness or tingling in the foot, weakness in the ankle and toes. If any of these signs sound familiar to you or even the loved ones, it's time you to get checked. Diagnosing a foot drop. So to diagnose foot drop, we have certain tests and scans to check whether there is a nerve damage or it is a muscle damage. We conduct physical examinations to check the muscle strength and the gait. Second test is nothing but a nerve conduction test. Here we include electromyogram and the nerve conduction studies. Here we measure the electrical activity of the muscles and the nerves. And the third diagnostic test is imaging, that is various tests like MRI, ultrasound and CT scan. Here in these tests, we look for any nerve compressions or any other spinal issues. Sometimes we use a combination of all these things to diagnose your condition. It's like troubleshooting an internet issue. We check different components to find where the signal is lost. What are the treatment options in restoring the movement and the strength? Here, it's a good news. Foot drop is a treatable condition. With the right treatment, people can walk freely again and have a normal life. The treatment depends upon the causes. There are various kinds of treatments, that is either it could be surgical or a non-surgical. So let's explore the different options. What are the non-surgical treatments? Not every foot drop needs a surgery. Some minor issues can be treated and recovered with a therapy, braces or nerve repairs. Let's look at them. Braces and splints. Here what we do is like we are going to put an ankle in one single position and rest. This helps to hold the foot in place and make walk easier. Physical therapy and strengthening training. Just like going to the gym to build the muscles, the physical therapy strengthens the weak muscles and improves the condition. Third is nothing but nerve stimulation. The tiny electrical pulses helps to wake up the nerves and encourage the movements. And lastly, there are some lifestyle modifications which you are supposed to do. Simple changes like using a supportive shoes and making home adjustments can prevent falls and improve the mobility. Next, let's look at the surgical treatments. The surgical treatments, that is when more help is needed. A foot drop is severe or it doesn't improve with therapy, then surgery might be the best option. There are various surgical options such as tendon transfer surgery, nerve grafting surgery, and nerve decompression surgery. Let's go through one by one. So what is tendon transfer surgery? It is nothing but a rerouting, strengthening. To understand the tendon transfer, think of your muscle like a cricket team. If one player is injured, the another steps in. So as in any tendon transfer surgery, we select a healthy tendon from another muscle that can spare some of its function without weakening, and then it is transferred to take over the function of the weakest muscle. In a company, it's like a reassigning the job roles of one of the employee to the another to keep the things running smoothly. The second option is nothing but a nerve graft surgery. It is like bridging a gap. If the nerve is severely damaged, we can use a nerve graft to reconnect it. It's like a joining a broken electrical wire. Think of an electric circuit in your home. If a wire gets damaged, the electricity flow cannot flow to the appliance. To fix it, an electrician adds new wire between the broken ends. Similarly, in nerve grafting, a new nerve root segment is placed between the two damaged ends. This allows signals pass through again, restoring the movements. And the last option is nothing but a nerve decompression surgery. It is like releasing a pressure over the nerves. Sometimes the nerves are trapped under the tight spaces, much like a water pipe being pressed. This is called the nerve compression. In this, what we do is by carefully we release the pressure over the nerve and can function freely again. Here we call it as a nerve decompression surgery. The road to recovery. Healing doesn't stop just after the surgery or therapy. Here, how you can ensure the best recovery outcome. Consistency in rehabilitation, that is, stick to the therapy sessions. Patience is the key. Nerve heals slowly, but improvement happens over the time. Stay active, stay positive. Small progress is still a progress. I have seen patients regain their mobility, confidence, and independence. For example, one of my patients was Nurul Islam. He was aged about 32 years and a lorry driver by an occupation. He developed a foot drop after a nerve injury. He was frustrated, dragging his foot while walking, tripping often, and struggling with the stairs. His leg nerves were damaged severely due to an accident and had a foot drop. We advised him to undergo a tendon transfer surgery. On the day of surgery, we gave anesthesia to the patient so that he doesn't feel any pain. Through a very small incisions, we carefully detached the healthy tendon and rerouted it to the top of the foot, anchoring it in place. After the successful surgery, the patient needs time to recover and rehabilitate. Recovery is a step-by-step process, just like learning to walk again. Initially, the foot is placed in a splint or a cast for about 4 to 6 weeks to protect the repair. During this time, the patient needs to rest and avoid putting weight on the foot. The beauty of the human body is that with the right guidance and the practice, muscles learn new roles and quickly. Once the healing phase is over, we start physiotherapy, which is very, very crucial. It's like teaching a player to play a new game. The transferred tendon has to relearn its new job. Simple exercises help to strengthen muscles and restore the movements. After about 2 to 3 months of therapy, he was able to walk without dragging his own foot. In 6 months, he was back with his normal activities, even jogging with his kids. Final thoughts. Taking the next step. If you or your loved one is experiencing the foot drop, don't ignore it. It's not a disease. The early diagnosis and the treatment really makes all the differences. Book a consultation today. Let's take up the first step towards recovery together. For Nurul Islam, it was not just about fixing a problem. It's about restoring his freedom, walking without fear, driving with confidence, and living a life without limitations. It's a fresh start.